everybody, it's Beth. I'm back with some videos about the hip now. This is going to be one of three that I'm going to do about the hip. I'm going to start with the osteology around the pelvis and a little bit with the femur. I'm going to go over the hip flexors today with this video, and I'm also going to run through the major motions available at the hip joint and just briefly rattle off the names of the associated muscles with those movements. So to start with, I'm going to go over the landmarks on the pelvis, and I'm going to start with the ilium here. We all know the pelvic girdle is ilium, ischium, and pubis. And at the front here we have the anterior superior iliac spine, or ASIS. This is one that we've all palpated on each other. I think we're all pretty comfortable with where to find it. We've got the iliac crest coming up and around. And then down in front here we have the AIIS, anterior inferior iliac spine. In the front here we've got the pubis. In the center we've got some cartilage called the symphysis pubis or pubic symphysis. The upper edge of the obturator foramen down here is known as the superior ramus. The bottom edge along here is known as the inferior pubic ramus. Then as we go along the side here, we can see the acetabulum, where the femoral head goes. And there's a couple gluteal lines on here at the back of the ilium that's involved with some of the origin points of the gluteus muscles, the various ones. Back here we can see the posterior portion of the ilium with the posterior superior iliac spine, or PSIS. I know we've all found those on each other. And the PIIS, posterior inferior iliac spine, and that one's a bit too deep for us to palpate, but we can find it on the models pretty easily. When we're looking for the PSIS on each other, that's the one that if you've got back dimples, it's right along there. And beneath here we have the greater sciatic notch, and that's where the piriformis runs through, and I mentioned that in a previous video about the clinical importance there. And then down here on the ischium, or the sit bones, we have the ischial tuberosity, and that's actually the bony part we sit on, that if we sit too long, you know, it gets achy and we just kind of shift. That's the bone that we're feeling. And then up here, you see these small pointy parts. Those are the ischial spines, and that's going to be important. There's going to be a muscle that attaches there we're going to be talking about in a little bit. Also here you can see on the femur we have the head of the femur, the neck of the femur. This huge thing is the greater trochanter. This is where we line up with all our assisted devices. And at least on bones you can see it matches pretty closely with the wrist crease. I know not all of us match up so neatly, but that's at least the textbook theory. Then we have the intertrochanteric line connecting the greater trochanter to the lesser trochanter. And then as we come down here, we get the linea aspera of the femur. And when we talked about the quadriceps, we had the medial ones attaching on the medial side, the lateral ones attaching on the lateral side. And about here we've got another little knobby spot that's the gluteal tuberosity, and that's going to be the insertion point for part of the glute max, which I'll be going into later. But I'm going to first run through the hip flexors, so I'm going to take you on the anterior side. So the hip flexors, basically it's a collection of three muscles that all combine into one by the time they get to their insertion point. We have the psoas major, the psoas minor, and the iliacus. Now the iliacus comes from the ilium, as it might sound like. It comes from this broad flat area here in the anterior side. We have the psoas major that starts way up here, the vertebral body of T12. So if you're checking on a skeleton, just go straight to the last rib. Starts here, so it goes T12, L1, L2, L3, L4 for the psoas major. Psoas minor comes in at the costal facet starting with L1 down to L5, so 1, 2, 3, 4, 5. Those two blend into one, the psoas. Psoas and iliacus join together. They come through the femoral triangle area here and then come around behind back to the lesser trochanter. You can see here it just kind of comes around on the inside. So based on its origin and insertion locations, it's pretty easy to tell once you start moving things around what that muscle does. Because it comes from here to here, you pull the insertion point closer, it helps you flex. The other thing you do when you can pull the insertion point closer is it helps externally rotate. These muscles are all innervated according to this textbook that I have here by the femoral nerve. So I'm going to just quickly run over before I get on to the next video what motions we can expect available to us with this style joint here at the hip. And I'm taking this information from Thyme, and I just went over this muscle group from page 423, just kind of showing you origins and insertions. So at the hip, I mentioned with the flexors we have the iliopsoas. So we have flexion. The iliopsoas is primary. Secondary is the rectus femoris. That's that two joint muscle that's part of the quads. It starts here at the ASIS. And some of the accessory muscles for this motion include the sartorius, the pectineus, the adductors, the glute medius, and the tensor fasciae lata, which is also abbreviated TFL for short. So if we have flexion, the opposite of that would be extension. Primary extender at the hip is the gluteus maximus. Secondary, we have the three hamstrings working together. And then we also have a little bit of involvement from the adductor magnus, gluteus medius, and piriformis. So we have flexion and extension. We also have abduction and adduction. For abduction, we have the glute medius, and this is one that they keep talking to us about, Trendelenburg gait, where you kind of get that pelvic shift when you're walking because of weakness there. This is why that's important, because it's the major one involved in hip abduction. Secondary, we have gluteus minimus, and also helping a little bit with abduction, we've got the tensor fasciae lata, sartorius, upper portion of the gluteus maximus, piriformis, superior gemellus, and obturator internus. For adduction, the main one is the adductor longus. Then helpers, we have the adductor magnus, adductor brevis, and gracilis, with a little bit thrown in from the pectineus, the obturator externus, and the lower part of the gluteus maximus. The other two motions we've got here at the hip are internal and external rotation. It can also be called lateral and medial rotation. The lateral rotators, now there's a bunch of them. We've got the gluteus maximus for primary, and then we've got what's known as the 6 short external rotators: piriformis, obturator externus, superior gemellus, obturator internus, inferior gemellus, quadratus femoris. And we've got a little bit helping here from the sartorius, the long head of the biceps femoris, the glute medius, and the psoas major. Medial rotation, the last movement available of the hip, is caused primarily by the gluteus medius, the gluteus minimus, and the tensor fasciae lata. We've also got a little bit of work coming in from the adductor magnus, semimembranosus, and semitendinosus. So just like at the knee, the lateral hamstring helps rotate outward, and then at the hip it's the same thing. For medial rotation, the more medial ones help kick in a little bit as well. And I'll be going into the rest of these muscles in my next video.